Thank you, Ale. It's such a pleasure to be here. So, do you see my screen? Yes? Okay. So, buttocks are a sign of beauty and attractiveness. But since life is not always a bed of roses, it's also the spot where different changes occur, such as laxity, skin uneveness, ptosis, volume loss, cellulite, crepiness, laxity, ptosis, skin quality, and unfortunately, usually all at the same time. And the desire to get a treatment that could address all these issues inspired us to develop this technique with the use of polilactic acid, or PLLA. And that's what I'm going to share with you now. So I'm Juliana Sarovi, dermatologist from Brazil. It's such a pleasure to be here with you today. And I have a 16-year experience using Sculptra, and I have been treating the gluteal area since 2010. When we inject PLLA under the dermis, it will trigger a controlled inflammatory reaction involving macrophages that stimulates fibroblasts to produce collagen. And what I love most about this treatment is the natural results it provides, as it's able to stimulate the body's own production of collagen. And 3 months after the injection, we have an increase of 66.5% of collagen type 1. We have many scientific evidences concerning about the efficacy and security of PLLA in face and body treatment. And in 2019, we published in Brazil the first consensus on the use of PLLA for skin laxity in off-face areas. The technique I'm gonna talk to you now is called Firm Enough. And we are proud to mention that it's under publication right now by Dr. Haddad, myself, and other colleagues from Brazil. This technique is based on 3 approaches according to our treatment goal: skin quality, lifting and contour, and volume and projection. So with this technique, we can treat laxity, we can improve the contour, and we can give volume to the butt, and even have a lifting effect. But the main question to be answered is, what are your patient's needs? The answer is in an appropriate assessment. In this technique, we identify 2 areas to be treated, 2 areas to be worked on. I'll call them the frame and the target. The frame is the area that is also addressed, regardless of the treatment goal. It has the shape of a 7 with an upper part and a diagonal one. Injecting in this region by itself already promotes benefits as lifting, improvement on the skin laxity, contour, and cellulite. And what about the target? It's in a specific area that will receive more product depending on the aim of the treatment. If you wanna treat skin quality, lifting and contour, and volume and projection. So let's go on for these 3 pillars of treatment, starting with skin quality. And when I say I wanna treat skin quality, I mean skin laxity, crepiness, cellulite, uneven skin, and any other issue to be related to the relief of the skin. So let's see this example. This is a 48-year-old lady who came to me complaining about what she called a hole in her buttocks. She's a very lean triathlete with a balanced diet, and she wants to improve her gluteal area. When we evaluate this patient, what draws our attention are these two depressions in the inferior part of the buttocks. And that's because this bone structure, the sciatic tuberosity, associated with fat loss due to age and body shape. When we look at this patient in a 45-degree angle, we can better see this depression, and this is what really bothers her. As we can see, there's some skin laxity and also an elongated infragluteal fold, extending further than the middle of her thigh. Through passive movement, we can better notice the degree of laxity, and when we pinch the skin, it feels loose. So, what do I want here? I want to improve the laxity, I want to improve the depressions, especially the dimple. This is what we know as skin quality. Treatment plan for her is injecting sculpture in the frame. As I said, it's always treated. I will inject 50% of my product or of PLLA in this region. And in this case, our target will be the area covered by the dimple. This is my marking points. Here, I ask the patient to contract her butt to see better the depressions. And here will be my target. I will inject 50% in the shape of the 7 and 50% in the target area. When I use sculpture, I do immediate reconstitution. So here, my experience is with sculpture. And the immediate reconstitution is like that. You have to add 5 ml of sterile water, then you shake vigorously for about 1 minute, and then add 3 ml of sterile water. Shake slowly to achieve a homogeneous mix. And here we have 8 ml of my product. For body injections, I will keep this product and add plus 7 ml of sterile water and 1 ml of 2% lidocaine. It's optional, but I always do like that. And so we'll have 16 ml of PLA ready to use in our patient. The injection plan is in the superficial subcutaneous tissue. The aim of the treatment is like to reinforce the skin containing system. So here is my injection technique. I do anesthesia in the entry point. I'm with a 22 gauge cannula with 7 centimeters long. I'm the superficial subcutaneous plan. I introduce the cannula and then I start a retro injection in the superficial subcutaneous plan. I want to cover all this area I have marked, and I'm injecting 0.2 to 0.3 ml in each retro injection in a fanning way. You have to stop injecting before reaching the entry point. So here, the injection technique in the target is the same as in the frame. I'm with a 22 gauge cannula, 7 centimeters long. I introduce the cannula and start the retro injection in a fanning technique. I'm injecting 50% of my product in this region, in the frame, and in the target. The most important thing here is to replace the product in the most homogeneous way as we can. The PLLA final reconstitution volume is 16 ml. So let's see her results before and 45 days later. You can see the improvement of the dimple And here we had just done one session, and in spite of this short period of time, you can already see the improvement in the dimples and the surrounding area. Here in this case, I used 4 vials of PLLA, 2 vials per site. During muscle contraction, after 45 days, let's see the improvement on the skin quality. And here we can see the improvement in the cellulite too. In lateral view, you see the improvement again, the improvement on the gluteal contour. And as a bonus, we have got a lifting effect. After 3 months, we can see considerable improvement in the shape and in the contour. We use 2 sessions for vials per session of PLLA, 45 days apart. We see a less elongated infragluteal fold and an improvement on the dimples that bothers her. Under contraction, again, the improvement on the skin quality. So let's see another patient. This is another patient with a need to improve her skin quality. She is a 48-year-old lady complaining about cellulite. Let's go on her body assessment at rest and under contraction. When the patient contracts her butt, we can better see the compromised areas. Through dynamic evaluation, we can see the degree of laxity. So our goal here is to treat the cellulite while treating laxity. My marking points, the frame that is always addressed, like I said, and the target. I will inject 50% of PLLA in the frame and 50% in my target. Let's have a look at the results. Before and after. After 45 days, patient at rest, and despite the partial result, we can already see the improvement on cellulite and skin evenness. I used 4 vials of PLLA, 2 vials per site. At a 45-degree angle, at contraction, the improvement in the skin quality, the improvement of the cellulite. Here, under movement, passive movement, 4 vials of PLLA, 2 vials per site, the improvement of laxity and cellulite. Contraction, such an improvement of skin quality. Amazing results. So the second goal of treatment in this technique, firm-up technique, is lifting and contour. In this case, we have to concentrate some more product in the region which will get more lifting or target. And this is exactly where it is. Dividing the glute area in 4, our target area is the upper outer quadrant of the buttocks. I want to concentrate a little bit more product in this region to create vectors and have a lifting effect. In this case, when we want to give lifting and contour to our patient, the frame will be injected with 60% of our product and the target 40% of our product. So let's see this 35-year-old patient complaining about ptosis, and we see there is a more elongated infragluteal fold. When we do this movement, we see there is a moderate degree of laxity. And the mission here is the lifting effect. So my marking points, as I said, we mark the frame, and here now the target. Let's see her results. 3 months later, we can see better the lifting in the gluteal region with a less elongated infragluteal fold and more attractive contour. During movement, the improvement on the laxity after 3 months of treatment and the improvement of the infragluteal fold. I used here PLLA 2 sessions, 4 vials per session, 8 vials in total, 2 vials per site per session. Here again in the lateral view, we see the lifting effect, the improvement on the contour and the skin quality. 8 vials in total, and here the same patient during muscle contraction, we can see better this lifting effect and the improvement on the contour. The third and last goal is volume and projection. So here, how I mark the patient. The frame, always treated, but here I will inject 40% of my product. And now, when we want to give volume and projection to the buttocks, we have to inject a larger amount of product in the region which will get more projection. There is a target. And this is exactly where it is. Dividing the glute area in 4, our target is now the upper inner quadrant of the buttocks. And here I will inject 60% of PLLA. This is our patient, 35-year-old patient with lack of volume in her buttocks. She has a beautiful butt, but she needs some projection and volume in the lateral view. So my marking point, the frame and the target. Here, when I want to give volume with PLLA while treating laxity, my target will receive 60% of PLLA and the frame will receive 40% of the frame. Let's see the results after 45 days. Her buttocks was already attractive, but now it looks even nicer with a more rounded and projected contour. After 3 months, again, the more rounded contour and more appealing buttocks. My protocol here was 8 vials of PLLA in 2 sessions, 4 vials per session, 2 vials per site per session in a 45 days interval. Here, let's analyze the improvement on projection according to the literature. The ideal buttock projection should be like that. The distance between the trochanter and the most projected point of the butt, letter C, should be twice the distance between the trochanter, A, and the pubes, letter B. In other words, AC equals to AB. And that's what we got with sculpture. Here again, after 3 months, the improvement on the contour and during movement, we see the improvement in the contour, this more rounded buttocks and less cellulite, less laxity. Now, in the lateral view, the improvement again in the contour. So, in a nutshell, let's see. The firming up technique involves 3 pillars of treatment, 3 approaches, depending on what we need, what's your target. If it's skin quality, if it's lifting and contour, and if it's volume and projection. So, in these 3 cases, the frame is always treated. The target will depend on what needs to be addressed. And there's nothing to it other than injecting the right amount of product, the right amount of PLLA into the right area to fulfill your patient's desire. Thank you all very much for your attention. Thank you, Ale.
Juliana, amazing results, amazing documentation. So congratulations on your presentation, and I'm sure we are going to have a lot of questions in the end, but it's not it's not because of a chance or any a case that you are considered the leader of the Gluteal Sculpt Academy. So Juliana is one of the major training centers of glute injections here in Brazil. So she trains monthly a lot of physicians in this technique. So later on, we are going to have a few questions that were addressed for you during your nice presentations.